Thank you, Senator. It's hard to follow some...
Do you have any passion?
Senator, I just wanted to ask you, college students are graduating with an unprecedented rate of debt after they graduate from school. What do you plan to do to alleviate these student loans and reduce the cost of school?
Thank you. Is this, do you have a comment? You're the photographer here, is that?
I'm the paparazzi.
Oh, the paparazzi for this rock star, I see. I see. Thank you. Skylar, thank you. You have very attractive friends. May I say, my friend, we have got to, in the short term, make sure that student loans are available for this fall, as you know, because of some of the problems that exist. And I hope that all the governors will make sure that the student loans are available in the short term. In the long term, we've got to move towards providing the kinds of incentives for young Americans to receive education. One of the issues that was brought up at the beginning of this conversation is educational benefits for our veterans. We've got to provide other educational benefits. The City Year, young people that go into cities all over America and teach children are rewarded with educational benefits, amongst others. I think we've got to put in programs for national service to serve the country in a whole broad variety of ways, and the first reward then would be educational benefits. That's the first step. And then, of course, I think it's we have to find ways to reward particularly educational benefits for those who are engineers, science, mathematicians, etc., because that is a very big shortcoming in our ability to maintain our technological and innovative lead. The photographer wanted to add to that? No?
I wanted to ask a different question, if that's okay. Hi, Senator McCain. Thanks for coming back to Colorado. I recently met a man named Frank from Colorado Springs who falls into the Medicare Part D donut hole. And I've heard your answers here that, we have to do what we did 20 years ago with with Medicare, what we did in Social Security, and go back and really kind of fix the problem. Do you have a more concrete answer for what you do for someone like Frank, who's a veteran like yourself, in a wheelchair, an amputee, and can't pay, his prescription drug bill?
Well, the first thing that I would do is make sure that if he's a veteran, that he gets eligibility for veterans care. Yesterday I was at the Phoenix Veterans Hospital and had the opportunity of meeting with many veterans who are being very well treated there. Now, we all know about Walter Reed, and we know about some of the problems in our veterans' health care. But there is a flip side to that, and there's a lot of veterans' health care facilities that are wonderful around the United States of America, including one here in Denver, as I understand. I've not visited it, and so I would certainly see if he's eligible for veterans' health care to start with. Second of all, I would have to know the exact specifics of his issue. There is Social Security disability payments. There are other programs. But if he's not eligible for get care, and I will make sure that we address that issue as quickly as possible. It is, the Medigap issue is there, and we're going to have to address it as well and put a fix in. No American should go without the necessary health care. That's one of the obligations of our society. But I also have to tell you, if the costs of health care continue to skyrocket and we don't do anything about that, we're not going to have affordable and available health care for any American. And we have got to get those costs under control, because there are not incentives now for people to keep health care costs down. And that's what many of the proposals that I have outlined, including, as I say, outcome-based care. If you give a health care provider a certain amount of money to care for that patient, and at the end of a period of time they've done a good job, then they should be rewarded. There's a pilot program which has been very successful. It's called Cash and Counseling, where we have given seniors actually the money in order to take care of their own health care needs. And guess what? That program has turned out to be pretty well and pretty economical. As far as people who are in these different donuts, and there are a number of them, obviously we have to fix them and we have to fill them. But if health care is not affordable, then we're not going to be able to make it available to that individual. And I'd be glad to hear from you and hear from Frank and see exactly how we can help him immediately without working on any specific government program, because no American should exist under the conditions that you describe, especially one of our veterans who served our country.